Let's see, other good myths. All breast cancers are genetic. Um, most breast cancers are absolutely sporadic. 85% of women who have breast cancer have no family history of breast cancer. I also get women who come in who are older who say, but I'm too old for breast cancer. I thought this doesn't happen. And the truth is that our risk increases exponentially as we age.
Yeah, exactly.
But that being said, we're still seeing, like we talked about earlier, a lot of younger women being diagnosed. And oftentimes younger women have more aggressive forms of breast cancer. So again, everything circles back to mammograms. It's just so important. Let's see, what are some other good ones I've heard? Men can't get breast cancer.
Yeah.
Men can absolutely get breast cancer at a much lower rate than women because they have less breast tissue. But it's very important for men to be educated on the signs to look for. When men present with breast cancer, they often have the least aggressive form of breast cancer, but it's oftentimes a later stage because they've either ignored it or thought that can't be what this is. So that's a big public health push too, is to get men to recognize those things.
Do you have anything on biopsies?
Biopsies, I get that a lot too. So breast cancer is not the kind of cancer that can move with a biopsy. Certain types of cancers are, and those cancers we never biopsy. For instance, there's certain kidney cancers that we never do a biopsy of because it can track, and pancreatic cancers, we don't do that through the belly because it can track. So yes, that type of thing exists. It does not exist with breast cancer. It's just not how it works. So a breast cancer biopsy will not spread your breast cancer, but it will identify it, and then we can treat it and hopefully cure it.
What else do you got?
What else? Let's see.
One or two more.
Let's see. Breast pain. Breast pain is a good one. So breast pain is something that I see a lot in my office. Women will get sporadic breast pains. They panic. They think that this is, absolutely the sign of breast cancer. It is very, very uncommon for breast cancer to present as breast pain.
Yeah.
Breast pain is extremely common. About 70% of women experience breast pain in their life. It's more common in the left breast than the right. We don't know why. And like I said, it's not often a sign of breast cancer. That being said, if you see a change, if you feel something, if you're concerned, it's always best to get it checked out. My point in bringing that up is that just because your breast hurts doesn't signal a cause for panic.
Yeah.
Right?
And the same with a lump. If you feel a lump, does not mean you have
it does
breast
not
cancer.
necessarily mean that you have breast cancer at all. But that should certainly trigger you to get to your doctor, get the appropriate imaging and the appropriate workup to make sure that it's not.
Yeah.
Let's see, what else? This one I've heard a couple of times from patients, that abortions can cause breast cancer. And this was something that was floating around in the community, and there's absolutely no link between having an abortion and breast cancer. There was actually a big study in 2003 by the American Congress of Obstetrics and Gynecology that proved that there was no link. So,
since you're talking about that, what about the birth control?
Birth control. I get that a lot. So if a woman has a breast cancer diagnosis and they are estrogen progesterone positive, we ask them to stop their birth control and to use a form of non-hormonal, either a copper IUD or a diaphragm. That being said, taking birth control has such a minimal increased risk that it's not considered a risk factor for breast cancer. We can't say absolute zero, but it's almost absolutely zero correlated with a breast cancer diagnosis because it's so low.
Good. That was something I've been told as well. There's just so many. The imagination of people just goes places.
Especially, things are scary and people get scared.
Yeah.
So,
to wrap up, would you like to tell us some more about Evolve Pink? Is there anything we left out? that you would like
So
to bring up?
let's see. Well, we're working on establishing our first Thrivers Lounge. So we've rented this beautiful space. We're in Flemington, so in Flemington, and we're going to outfit that. We're splitting it between an exercise program that lives there as well. And we're going to outfit it really beautifully as a women's lounge where women can kind of come, commune, set up their laptop. Everybody's working from home these days, so they can go there and relax, have a cup of coffee, and work out of the house for a little bit. We'll hold guest speakers there, all kinds of things we're going to do there. So that's what we've been working on this coming up.
That's great. That's incredible.
Yeah. So we'd like to reach whoever we can reach, whoever we think, anyone who thinks that they could benefit from this, we're available. We have a website. We're on the social medias. I'm always available by messenger. So
yeah, and absolutely, I will put all your links to all your things on in the episode notes. And please count on MindBloom for advertising, promoting, putting it out there, pushing for it. I love.
And we're not limited to just women who've had a diagnosis. We also include high-risk women because so much of what we do impacts the rate of diagnosis: nutrition, exercise, education, all of those things. So anybody with LCIS or anything like that is welcome.
Thank you. And I can guarantee you, once we find that out, we are as scared as someone with a breast cancer diagnosis. The questions are there.
They're there. Yeah. It's almost in a way more difficult to navigate because you don't have an answer. It's just, you just know that you're of increased risk and you're given options and you kind of have to make a decision. So I get it. It's a difficult thing to navigate.
Yes. But this was so enlightening. I feel so much better, even about the tamoxifen. Maybe I'll give it a try.
It's not so bad.
All right.
All right.
Dr.
You
Jen.
can try it and stop. It's like everything.
No, like everything. Thank you. Dr. Jen, this was a pleasure. You're amazing.
My pleasure. So are you. My pleasure.
Thank you. Bye-bye.
Take care.
Bye-bye.